I'm Susie Scott. I'm the Chief Nursing Officer for Providence Swedish South Puget Sound, so that's St. Peter and Centralia hospitals. When I first met Dr. Gilbert 3.5 years ago, the first thing that she did was walk me through her vision for the Abuse and Intervention Center. And it was clear that she had such a strong vision and a passion for our community, compassion for the patients that she's taking care of. She is such an advocate, and it's so amazing the work that she's been able to do leading her team and caring for her patients.
Hi, my name is Joyce Gilbert. I'm the Medical Director of the Providence Abuse Intervention Center. Our Abuse Intervention Center is part of a Child Advocacy Center, and a Child Advocacy Center gives wraparound care to any child who has been sexually abused, physically abused, or maltreated in any way. The child can come to this facility and have a forensic interview with a trained interviewer. They can have a medical examination, and they can receive ongoing therapy if indicated at this facility.
So my name is Heather McLeod, and I am a nurse practitioner and also a forensic nurse examiner supervisor at Providence St. Peter. I took initially just a per diem job as a forensic nurse examiner in the emergency department, so seeing patients who had presented after a sexual assault. And then maybe a year or so into that, I came to the Abuse Intervention Center to help out. At that point, I found that working with this team was some of the most rewarding work that I've ever had. That as a nurse practitioner, being able to focus on one patient or one family at a time and give absolutely comprehensive care to that patient or family really fed my heart in a way that other healthcare work was not doing at the time.
They are such strong advocates for these survivors, providing them with the resources that they need in the moment. The team also is very proactive in their approach. They get out and educate our educators and other members of the community so that they can recognize early signs of abuse and neglect and get our community members the resources that they need early.
So I think the fact that we network with so much of our community, law enforcement, Department of Children, Youth and Families, primary care offices, advocacy groups. I think we provide this catch-all specialty care in a very unique situation where trauma has occurred in families' lives.
Children are less traumatized by coming to a child advocacy center than not. And again, they are believed for what they've told us, and they receive services both in our clinic, in our advocacy center, and then throughout the community. We have a group of facility dogs, 3 different dogs, that work in all aspects of our child advocacy center. And once, many years ago, a little 8-year-old boy had been abused, and he had told the appropriate people, the law enforcement, the forensic interviewer, and the medical provider about his abuse. But when the dog was present, he was more relaxed. And so when they had to go to court and he had to face his abuser, the dog sat at his feet in the courtroom. He held the leash, and he gave a better description of everything that had happened to him than at any other time. What we can do for a child who has been abused in any way is we can actually change the trajectory of their life by giving them appropriate, adequate, timely care.
I can't think of 2 better individuals, 2 stronger leaders for this award. They have been able to take care of so many members of our community and our caregivers that are taking care of our members of the community.
I am feeling very honored to be chosen for this award, but I also think it's not just me, it is our clinic, it's everybody that works in our clinic that promotes the best care for the children.
From our medical assistants and nurses to our nurse practitioners to our education and outreach coordinator, we have this team of individuals who is so dedicated to taking care of our children that we see and the families that we support. And I think that's really special. So I look at this Distinguished Service Award as reflecting on our entire team and their dedication to service and to providing hope to people in really a time of crisis and trauma.